Hi, and welcome to our EEA Ask an Expert for this edition. Today we're talking about green spaces in cities. Who benefits? Joining us today is Aleksandra and Catherine from our Adaptation and Health and Environment units here at the EEA. And my name is Ganzleben from the press office here at the EEA. So we recently launched a briefing on who benefits from nature in cities. Aleksandra, first of all, may I just ask you what your role is here? What are you working on specifically in relation to this report? And Catherine as well.
Sure. I'm currently working as an expert in climate change and human health. So my main role is the coordination of the European Climate and Health Observatory. However, another strand of my work is environmental inequalities. And that's within the strand where this work was carried out, looking at how environment affects different groups of people in a different way.
Sure, and I lead the team on air pollution, environment and health. It's a really committed and passionate team, and we work on issues including air pollution, also exposure to noise, exposure to chemicals and the impacts of climate change. And we look at how those risks impact on human health in Europe.
Mm-hmm. Quite an important area of work here at the EEA. Before we delve into it, if you have any questions or comments for our panelists today, for our experts, please don't hesitate to put them in the comments and reply section. I believe we are streaming on Twitter, Facebook and LinkedIn today. So more questions, comments, they're welcome, so we can really have a good discussion here today. Aleksandra, can you tell us a little bit about the recent report and the findings?
Yes. So we published this briefing, like you mentioned, just over a month ago. And what we tried to do was not only to look at how green the European cities are, but also who benefits from access to green space. So we looked at the data from Copernicus land monitoring system to see where the green spaces are, and also analyzed scientific evidence telling us something about the socioeconomic inequalities in access to green spaces. Furthermore, the briefing also includes a set of case studies trying to promote good practices and provide some inspirational examples how the access and use of green spaces for vulnerable groups can be improved.
And what do we mean by green and blue spaces for people who might not know the terminology here?
Yeah, very simply, it's all the spaces in cities covered by water or by vegetation rather than by buildings, roads and tarmac in general. In the context of the briefing, we were working with sort of three categories of green space. One was the total green infrastructure, which means everything that's green and blue as seen from above, because we worked with remotely sensed data, but also the green spaces that are like parks and gardens that are made on purpose for human use, and urban tree cover as well as the third category.
So also like trees on streets and stuff like that?
Yes, so tree-lined streets, groups of trees, little forests and so on.
Okay. And Catherine, how important are these spaces to the health of Europeans?
Well, they're really important. And I think we saw that during COVID when there was lockdown and we were essentially restricted to both private gardens and to some extent parks. And they're crucial really for all ages. So for children, for example, children who play in green spaces and in nature, that play and learning supports both their physical development but also their mental development. There's also an issue where if children are exposed to microbes in the environment, it stimulates their immune system and it helps their immune system to develop to be more robust as they grow up. If we look at adults, adults use green spaces for recreation, as places to rest where it's quiet and peaceful, but also as places to exercise. And we can see that the provision of green spaces and their use actually leads to improvements in health at population level. So we see lower levels of heart disease, lower levels of diabetes, and improved mental health. Also for the elderly in our society, green spaces are really important areas where they can go and socialize. The elderly tend to have less money and obviously less activities ongoing during the day. So they can go into green spaces, and that really reduces their sense of isolation, which is linked to improved health. It's also a space where they can exercise, and we see there that it's linked to lower mortality rates and longer lifespans. Mm-hmm. So it's really important for all these different age groups. But also, if we look socially, across the socioeconomic classes, it's particularly important for the poorer members of our society who may not have a larger house with a garden and therefore rely upon public access to high quality green spaces for their children to play in, for them to exercise in, and for their grandparents to go and stretch their legs. And finally, I would also just like to mention this issue of social integration, because we see evidence from across Europe that migrants and refugees in particular make use of public green spaces, and it provides a space where they interact with the local communities and facilitates their integration into those communities. So I think there's a number of really clear, well-evidenced reasons why we need to both maintain high-quality green space in our cities, but also increase access.
Mm-hmm. And we'll get to the point about where we are with cities and how many green spaces there are. But I guess the COVID pandemic really made clear their value to our society. I mean, anecdotally, we saw loads of people out going for walks, even socially interacting because they couldn't otherwise. So we really saw that impact, I think, over the last few years. Let me just get back to the audience. If you do have any questions, please also use the hashtag EEA Ask an Expert so we can find your questions on Twitter as well. And if you do have comments or questions, please don't hesitate to put them in the comments or reply section. Aleksandra, what role do the green and blue spaces play in adaptation to climate change?
Yes, the role of green spaces in adaptation to climate change is increasingly recognized. And we can see that, for example, in the European policy, where the so-called nature-based solutions are really emphasized as a great mode of adapting our cities to the changing climate. And that's for a good reason, because we can see that urban green spaces and in particular trees can really improve the thermal comfort for people on hot days, reduce the air temperatures quite substantially. Also providing green spaces to deal with stormwater is an excellent idea, as they act as sponges to infiltrate the excess water and avoid it hitting the drainage and causing flooding. So I think that bringing the cities more to their natural shape is the way to go to deal with what we are already expecting and what we can see in the future: more extreme precipitation, more extreme temperatures.
Yeah. And your report touches on how cities are doing, a bit of sort of a ranking of cities, looking at how much green and blue spaces they have. So how are we doing? How are European cities doing? Yeah,
it's just a bit of a caveat maybe, that it's really difficult to talk about the typical European cities. They're all different, they all developed in a different geography, they all have different history, how they were planned, how they developed, and that affects how much green space there is. But just looking purely at the data that we have, we can see that the green areas, any type of green areas, cover on average around 42% of cities in Europe. However, if we look at the accessible green spaces, the order of magnitude is lower, because it's actually only about 3% of the city area that on average is accessible to people and green. And if we look at the tree cover, it's around 30%. That's the average for European cities. However, there are massive differences between the cities in Europe. So when we look at the total green space, we can see that some cities have as little as 7% of their area that is green, and some cities have 96% that is green. And I think it's really stark in relation to tree cover, where we see that the Nordic cities in Norway and in Finland have quite a lot of trees, and even over half of the area is covered by trees. When we look at cities in Cyprus or Malta, but also in Iceland, this is much, much lower. It's only a few % of the city area.
And what data do you use to get this sort of, where does this information come from?
Yeah, so we rely on the Copernicus land monitoring system and remotely sends data, so-called urban atlas, which is mapping the land use and land cover in urban areas, and a few other products that we use to compile this urban tree cover layer.
Okay, and Catherine, what social, economic and demographic inequalities are we looking at in access to these spaces?
Well, I think Aleksandra touched on some of it. So, as Aleksandra mentioned, a large proportion of the green space in cities is private land. So it's in people's gardens and therefore not accessible. But even when we do look at publicly accessible green space, we see consistently across Europe that wealthier neighbourhoods have a higher proportion of green space than poorer neighbourhoods. They also tend to have higher environmental quality overall. So we're also talking about better air quality and lower levels of noise. I think one of the factors that plays in there is this concept of gentrification. So if a neighborhood is green with a large park, it makes it more attractive. And then the house prices rise. People want to have a green space where their children can play, where they can go for a jog, where they can walk their dog. And so the consequence is that it drives up house prices in that area, and then it becomes more of an exclusive area for the wealthy. So we really do see these distinctions. And they're not just socioeconomic. We also see associations where areas of cities where there are a higher proportion of immigrants living. They tend to be poorer areas, but they also tend to have less access to green space. And when you set that against the evidence that we see, the evidence tells us that green spaces are, in fact, crucial for those groups. So for the poorer people and also for the migrants in terms of allowing them the space to integrate with other people across the community. So there's a real mismatch between people's needs and the access that we actually see across Europe.
Mm-hmm. Okay, interesting. I see now we're starting to get some questions in. So again, if you have any replies, comments, questions, anything you want to discuss on green spaces, blue spaces, please don't hesitate to jot them down on our comment section on LinkedIn, Facebook, or Twitter. We have one from Marcel on LinkedIn. Can you comment on the link of green spaces with quiet areas?
Sure.
That's
so
noise pollution, I guess. And
certainly, and this is a really good point, and it's actually an area where we're looking to do some research this year. So at the Environment Agency, we receive noise data from across Europe. So we have information about how noisy different cities are. And using that, we can look at those acoustic maps and we can identify quiet areas, right, where the levels of noise are much lower. And one of the steps we want to take this year is actually to map the location of those quiet areas against green spaces to see if they spatially coincide. Our expectation is that generally they will. It would make sense logically. But we want to do that analysis in order to then be able to come forward with that definitive answer.
okay, great. Again, if you have any comments or questions, also don't forget to use the hashtag EEA Ask an Expert on Twitter, and we'll hopefully find your comments or questions there. I guess to both of you, what other work have we done in this area on green spaces and on social inequalities, environment and health?
Then data that the briefing that we are discussing here is based on has actually been published in a couple of data viewers where you can find information about green infrastructure in the city where you live or in the country where you're based, and also a viewer on urban tree cover, so that also provides access to more information and more data about the provision of green infrastructure in our cities.
And we'll put those links on in the comments section so they can see that.
Yeah, and when it comes to environmental inequalities, I think that was it 3 years ago we had a report that was looking at the unequal exposure of different populations to environmental issues, including air pollution, noise, and extreme temperatures. So it was looking at the inequalities in both exposure to those impacts, to those hazards, as well as the actual health impacts that different types of populations, different groups, socioeconomic groups, demographic groups, actually can expect from a given hazard.
Yeah, and maybe just to build on that, in 2020 we published a report called Healthy Environment, Healthy Lives, where we quite systematically looked at the dynamic between environment, health and well-being. So we looked at some of the negative risk factors that threaten health. So that includes, for example, air pollution, which is linked to cancer and stroke and heart disease, where we see over 300,000 premature deaths per year. We looked at the issue of environmental noise, which causes stress and sleep disturbance and is linked to 12,000 premature deaths from heart disease. We looked at exposure to chemicals. And for each of those, we did explore the socioeconomic dimension, so how they're distributed across society, and found that fairly consistently poorer people are exposed to higher levels of environmental risk. But we also look at the positive side. So we also look at how our environment, and in particular nature, really supports our health by providing the essentials that we need every day. So clean air, clean water, high quality food, but also these spaces for rest and relaxation and social time and exercise.
I mean, how far have we come over the last decade in green spaces and blue spaces and public awareness of their importance? I mean, that must be quite revolutionary. We're talking on the European level on how important this has become to our daily lives.
Yeah, I mean, I would say that house prices have always been affected by the quality of the environment, by the access to a park or riverfront or seafront.
Public transport station, something like that.
Yeah, so I do think it's always been a factor. I think, like we mentioned earlier, the COVID pandemic and the restrictions that people faced on their life really brought to a front how important it is to have access to these kinds of spaces. And I would say the evidence base, so the research looking into and really identifying concrete health benefits, quantifiable health benefits in terms of reduced disease and reduced premature death, that has been built over the past few years.
Yes, if I can build on that, the general concept of, for example, green infrastructure, something that is quite common for us, I think, and for the planners, for the policymakers, it's a concept that is being understood.
Yeah.
It's actually quite young. It's less than 20 years old. So over the course of the last 2 decades, there's been an enormous growth of awareness of the benefits of green spaces and enormous growth of the body of evidence. But at the same time, the first seminal studies that were looking at the health effects of green spaces go back to the 1980s. The famous study of patients recovering better in hospital when looking at the tree outside rather than looking at the brick wall and so on.
Yeah. We have some questions here. I have one from Tiago. I'm not sure we got your question entirely, Tiago, but how to promote the tiring from climate change adaptation to new land use plans. And we have another one which is not directly related on energy bills going out of control with astronomical fossil fuel price increases. Why is waste heat from data centers, incinerators, and geothermal not being prioritized so we can decommission millions of fossil fuel home heating boilers and help reduce the cost for households? Not directly related to the episode today, but certainly we'll try and get back to you online with other experts on these questions for you. But perhaps related to this, what is the cost of changing these cities and the infrastructure and the grid? This must cost a lot of money and investment and time for authorities, both on national, regional, and local level, to create these plans, to change city architecture, landscape planning. I mean, to what extent is this being considered in creating new subdivisions or renovating city centers? Do we have any work on that?
I'm just trying to think. I don't think that we've directly looked into the costs and benefits, but I think there is a growing awareness that green spaces are not only nice to have, but they're becoming an essential part of the built environment. And there are studies that are monetizing the benefits to health, that are calculating how the days not being taken by people as sick leave actually contribute to the economy, and how the health benefits derived from green spaces can actually be monetized and calculated. So I think that in many cases the benefits can exceed the costs, but maybe Catherine, you have something to add on that.
Yeah, I mean, I would agree. I think you hit the nail on the head. I mean, if we look at healthcare expenditure in Europe, 97% is spent on medicinal care and on hospitals, essentially, and medicine. And only 3% is spent on prevention. But what we're talking about is not just an environmental nice to have, it's actually a tool in preventing disease and early death. And as you say, then saving healthcare costs. So if we look at that investment in green infrastructure in cities and then we set it against the savings, we're actually benefiting, we're saving money. So I think this is also something we try and encourage when we work with the countries in our network. We have a very broad network of European countries. And we're trying to encourage the health department, the urban planners, and the environmental agencies to work together to really identify and profit from these synergies across these different areas, so that they don't just see it as a cost investment, but do explicitly recognize the economic benefits in terms of improved health.
Mm-hmm. I mean, we've seen a lot of these green belts around cities or within belts. I mean, they've been there for many years, but I guess now become even more essential to our well-being. And perhaps also, we've seen examples and case studies that cities can tap into via Climate Adapt, and what the European Commission is doing with us on that area. Could you perhaps explain a bit how that works in setting examples for city authorities and model case studies or something?
Yes, so both within the Climate Adapt, which is the European Climate Adaptation Platform, we have case studies that are looking at how different actions were being implemented, what benefits they brought in terms of climate adaptation, but also other factors such as, for example, human health. And we have, for example, something that's very closely linked to the topic of this briefing, a case study from the cities of Trnava and Košice in Slovakia, where sort of neglected space between buildings was turned into a green oasis to provide shade on the hot days, and it was done specifically targeting an area with a retirement home and a kindergarten in the middle of blocks of flats to serve the populations that might need this green, cool space the most. But also for the purposes of the briefing, we looked at various case studies that are looking, for example, at urban food growing. So not only using green space, but actively interacting with it and getting all these additional health benefits, such as inhaling friendly microbes and so on, but also collecting the fruits and vegetables, integrating with others, getting a lot of benefits. And so I would encourage people to have a look at the briefing and see what case studies are included there.
Yeah. We're almost running out of time, so if you have any questions or comments, please put them down now so we can get them to our experts. I guess looking ahead to what we've been working on, what's the next step in these? Are we working on more projects on green spaces, blue spaces, and health-related issues?
Yes, we still have some really, really exciting data that we haven't managed to squeeze into this little briefing. So what we want to do is look at the provision of green space around some social facilities that serve the vulnerable populations. So how green are the surroundings of schools in Europe? How green are the surroundings of hospitals in Europe? Are the green spaces actually present there where they can provide the most health benefits to the vulnerable populations. So we are planning to do this analysis and publish it in some format, maybe through the European Climate and Health Observatory with the adaptation angle. But I'm sure with Catherine we'll be working on that closely together to make sure that we squeeze every little last bit out of this data to provide interesting findings.
Mm.
Yeah, and then maybe a few things from my side. So this year we are supporting the European Commission. They have a policy piece called the Zero Pollution Action Plan, looking to really push to reduce pollution across Europe to explicitly benefit health. And we're working to assess a baseline. Where are we? How polluted is Europe? What's the point of departure? And that will be coming out in November of this year. We are also building an exciting new online product called the European Environment and Health Atlas. This will be an online map where users can go and look at their local environment and see what the air quality is, how it impacts health, what the noise is, where the green spaces are, and indeed compare to other areas across Europe. And then finally, we're also developing a series of analysis of the environmental burden of disease. So this is explicitly looking at chronic diseases. And first we will be looking at cancer, and in May publishing a briefing looking at how different environmental risks drive cancer in Europe. And our next stop will be heart disease next year.
Okay, wow. So we've got quite a full agenda ahead. Again, I think we've run out of time for now, but please find the links to the reports, and also in the report you'll find how your city, if your city's in there. Are all cities included? Not all cities are included in the ranking.
No, we have the, well, I wouldn't like to use the word ranking,
Fair
but
enough.
we have the statistics for European capitals for the 38 countries that are covered by the European Environment Agency's activities. So we have the data there on the proportion of green cover, on the accessible green space and urban tree cover.
Mm-hmm.
So.
Great. And you can also look at the case studies as well for some interest. Thank you all for joining us. Thanks to the experts for joining us today.
Thank you.
We will see you next time on EEA Ask an Expert. Bye for now.